We're going to hear from Judith McFarlane.
Thank you, thank you. What a privilege and a pleasure to be here. There we go. What I'd like to talk to you about for a few minutes is cost effectiveness and that cost benefit put in at the beginning, and what kind of infrastructure it might take within a program, within a research initiative, to make it happen at the end. Frequently, it is tacked on at the end. And there's a 16 Fragile Country initiative going on right now. It's in the 4th year of a 5-year initiative that began 10 years ago. UK Aid put out a call for proposals for $25 million to find out what works to end violence. And several coalitions went together to apply for that $25 million to learn what works to prevent violence in low-resourced countries. And the recipient was the London School of Hygiene, the Social Development Direct Network, and the South African Medical Research Council in Pretoria, South Africa. That collaborative was awarded the $25 million to choose 16 fragile countries that were low or possibly middle resourced to learn what works to prevent violence against women and girl child in an environment such as low and medium resourced. There was a particular interest in signaling and flagging very tumultuous environments, such as Pakistan. And so Pakistan was going to be on the list. They put and there were several other countries, Yemen, Nepal, that were on the list also. The call was put out and there was over 1,000 applicants from NGOs, from universities, from collaboratives. I was fortunate enough to be on the final evaluation team, and knowing that Pakistan was a designated country, there were 5 projects that made the final 40, I believe, final 50 for consideration. Very different from what I had worked on in the future. To be eligible, you had to prove in your application that you had evidence that your project had been scaled up and it was sustainable. We usually think of doing the research and then how can it be scaled up, how can it be sustained, but going in for selection on the front end, you had to have proven that already. So it seems to us, it seems to the collaborative now, the countries of 16 that are working on this, that this is perhaps an essential structure to build for us to have the medium for cost effectiveness, cost analysis at the end of the research, to be able to situate it, to do it. Going in with choosing research projects that can be scaled up and can have proven their sustainability. So one of the projects chosen was in Pakistan, and it is labeled Right to Play. It has been in operation for almost 20 years. It has proven its scale up and sustainability internationally in over 27 countries. And what I'm going to do now is look for this magic little arrow at the base that should allow us to see for about 1 minute and 20 seconds what this program is all about. And the purpose of the rest of the talk is to talk about the other essential ingredients to get ready for the cost analysis of it. And you know what? I'm not seeing it, but it is on the computer. There it is. There's that magic arrow. This is about the Right to Play program. So ingredient one, we have a program to learn effectiveness on preventing violence that is sustainable, that is scaled up, it's on a global platform. The essential component two seemed to be for us is that we needed evidence for the effectiveness. It had never been empirically tested. So we were introduced to the concept of two teams, which was all prescribed in the research grant, is that yes, the NGO had been chosen as the intervention for testing, but there would be an outside partner that you would pair with who also Pakistani on the ground to do the research. So we had what we formally and informally called as a forced arranged marriage. The two people had never known each other before, they had never worked with each other, and the intervention people were introduced immediately to a foreign language, as they said, such as RCT. Oh no, there's a cluster RCT, all about fidelity and had nothing to do with marriage or relationships. And so there was automatically a great deal of relationship building that had to be done before we even went to the community. We had to get those components on board together. That took a bit of while. Two research teams with over 150 people involved in the teams. Some of the listing of the names, did formative research for a year before we went into the quantitative research to make sure that the questions were the questions of the community, that we understood the language of the people. Third important element we felt to go towards that cost effectiveness, cost analysis at the end was to have our stakeholders. So we have our teams, we have a scale-up, sustainable intervention, but we need buy-in, credibility from the stakeholders, especially the community and the policymakers at the community, the local, the provincial, and as well as the national level. So we started to covet that, and I can't tell you, we needed all 150 people's cousins to make this happen. I now give presentations and I just talk about cousins and certificates, because part of the empowering process, and we haven't even begun the intervention yet, we've not even begun it yet, is getting the stakeholders all on board to make sure that there's an understanding at all the levels of policy enactment and uptake that's going to be needed before we begin the intervention. And why the cousins? Because it's all about who you know, as we know. And getting the buy-in at all the levels, it required all 124 people, I'm the only non-Pakistani on the team, and all of their cousins, to get the segues into the meetings, into the coalition building and the stakeholder meetings that we needed. And certificates, you don't have meetings in Pakistan unless you're going to give out certificates. And bring food, of course. And the fourth component seemed to us, before we started with the cost effectiveness, is that whole uptake, which goes way beyond dissemination. And we're working with that now. We're in the second year of the intervention and doing that uptake at each of the levels. Uptake at the community level, where we have parent meetings. Just a little bit about the study. It is a cluster randomized controlled trial, so we do have 40 schools. It is a school-based intervention. And I know this presentation is not about the intervention, but we begin with parent groups getting buy-in at the family level, and then at the village level with the village elders and the policymakers, and on up to the district level with all of the schools involved, and then on up to the provincial level and the national policy level. So getting uptake, informing everybody of every step of the way. This is some of the dissemination that we're doing, the publications, and we do have our NGO on all our publications, because we are one team, not researchers and interventionists, but one team. Here's the children taking the baseline data. I was in country 4 days ago, and we're at our second year data collection, and I wanted you to have some fresh photos of the youth taking the interviews about their levels of perpetration and victimization and their mental health. This is after 1 year of data collection. Data collection was done at baseline, and so this is the second year of data collection. At the boys' schools, the schools are all segregated. The public schools are in Pakistan, so the boys go to boys' schools, the girls to girls' schools, and the teachers must match the gender of their students. This is the youth engaging in this scaled-up, sustainable program called Right to Play, which teaches conflict resolution, builds self-esteem, and how do you deal with getting the ball from the fist without having a fist fight. So this what this is about, through simple interactive games where the youth are taught how they can focus on the meanings of the game, reflect on their interaction in the game, and what application that has to violence-free relationships within their context. And this, to me, says all about our end product, that what we are looking at is decreases in perpetration, increases in mental health of youth age 6th grade, and hopefully something that will be integrated into policy as we go through, instead of at the end. We are almost ready to work with our partners on cost effectiveness, cost effectiveness analysis for this intervention. But we didn't feel we could do that until we had the total infrastructure brought up with us. For the cost effectiveness, we will be looking at the time that the program is implemented with coaches at the school who implement 2 40-minute sessions each week for each class. Most of the coaches, private personal transportation is almost unheard of in Pakistan, except among the rather wealthy, and public transportation is very unreliable. So we will factor in for cost, human capital cost of walking that 2 hours in the morning and 2 hours in the evening to and from work, what that means. So it's going to be a very granulated cost as well as benefit. We're already looking at the headmasters and the headmistress integrating this into their schools after it ends. They're already taking platforms forward. Do we want to continue this program? How can we continue it? To looking at the effectiveness and sustainability and integration. So this was just kind of a glimpse of how, as researchers, we might look at costing from the front end instead of the back end. And it's another approach to the whole idea of cost analysis on programs that work, so that we can give that information when we disseminate it at a wider scale. I'd be happy to have your questions. We're going to have one more presenter, and I think we'll have ample time.
Thank you very much, Judith.